Tetanus, also known as lockjaw, is an infection characterized by muscle spasms. In the most common type, the spasms begin in the jaw and then progress to the rest of the body. These spasms usually last a few minutes each time and occur frequently for 3 to 4 weeks. Spasms may be so severe that bone fractures may occur. Other symptoms may include fever, sweating, headache, trouble swallowing, high blood pressure, and a fast heart rate. Onset of symptoms is typically 3 to 21 days following infection. It may take months to recover. About 10% of those infected die. Tetanus is caused by an infection with the bacterium Clostridium tetani, which is commonly found in soil, dust and manure. The bacteria generally enter through a break in the skin, such as a cut or puncture wound by a contaminated object. They produce toxins that interfere with muscle contractions, resulting in the typical symptoms. Diagnosis is based on the presenting signs and symptoms. The disease does not spread between people. Infection can be prevented by proper immunization with the tetanus vaccine. In those who have a significant wound and less than 3 doses of the vaccine, both immunization and tetanus immunoglobulin are recommended. In those who are infected, tetanus immunoglobulin, or if not available, intravenous immunoglobulin, IVIG, is used. The wound should be cleaned and any dead tissue removed. Muscle relaxants may be used to control spasms. Mechanical ventilation may be required if a person's breathing is affected. Tetanus occurs in all parts of the world but is most frequent in hot and wet climates where the soil contains a lot of organic matter. In 2013 it caused about 59,000 deaths, down from 356,000 in 1990. Description of the disease by Hippocrates exists from at least as far back as the 5th century BCE. The cause of the disease was determined in 1884 by Antonio Carl and Giorgio Radon at the University of Turin, with a vaccine being developed in 1924.